Hey everyone, it's Amy from the QA and Compliance team, and I'm back today with this week's edition of The Right Way Wednesday. So, I had a chance to speak with one of our documenters of the quarter from 2017 to kind of pick her brain a little about how she documents and what makes her successful when documenting medical necessity. Lachey Lafferty, a PT from the Heritage of Brentwood, was our documenter of the quarter for Q2 of 2017. And here is what she had to say when I asked her some questions relating to completing an evaluation. So since we always say that our evaluation is the most important part of our documentation because it's in this document that we must convey the need for skilled services, and it's also the document that establishes the foundation for the episode of care as it guides all treating therapists. So in the first two sections of the evaluation is where we'll find our reason for referral and therapy necessity. So I asked Lachey what she thought is most important to include in these two sections. I started with the reason for referral section of the evaluation, and here's what she had to say about that section. When I think of reason for referral, I make sure to include who made the referral and why, including specific incidents, actions, behaviors, and problems that led to the referral. It is important to remember not to just say why the patient was in the hospital, but why they were unable to return from the hospital to home. What specifically caused them to require skilled therapy? And we can't agree more. This is exactly what we want to see in this section of the eval, as it is here that we need to show who exactly made the referral and for what, providing specific information regarding the precipitating factors that led to the evaluation. Okay, this is the why that we need to focus on and what Lachey finds most important about this section as well. So then I asked Lachey about the therapy necessity section of the evaluation and what exactly she focuses in on here. And she told me that her focus for therapy necessity is to restate the reason for referral briefly, and then to provide the support for the complexity that she has chosen. She likes one of those options in the drop-down box in the input daily section for the eval note. You know, the one that talks about the complexity factors of the evaluation. She said, I often use this and I summarize my eval findings to support this. Then I state what services physical therapy can provide to address impairments, functional deficits, and risks to safety. I always conclude this section with my consequences statement. And again, we agree with Lachey by providing these statements and to make sure it is very clear why the patient needs us and not any other individual or discipline within the facility or a caregiver. So I hope this video has been helpful for you as you're completing your evaluations and thinking about what you need to include in the first two sections of your plans of care. If you have any questions related to this video, please feel free to type here in the box any question that you may have, or you can also reach out to us via email at denials@healthpro-heritage.com or documentation at healthpro-heritage.com. And thanks for watching and happy documenting.